Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today we welcome Theekshana Fernando. He is a research scientist. His Kevin MD article is titled Revolutionizing Oral Health Care, the Affordable Solution That's Breaking Barriers and Boosting Health Equity. Theekshana, welcome to the show.
Thank you so much, Kevin. I'm very happy to be here.
We'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
Okay, so I am a physician by training. I studied in Kathmandu, Nepal. I completed my medical education there as well as my medical internship. The the medical school that I studied at, it was quite unique in that it really focused the concepts of public health and community medicine in their students, which I thought was fantastic. And some of the experiences I had during my medical education, together with my experiences in India, Bangladesh, and Sri Lanka, they showed me how if properly leveraged, public health systems can actually make such impactful and long-lasting improvements in health. So I wanted to learn about the upstream drivers of change. I wanted to learn about population level changes and advances to health equity. And with that in mind, I moved away from clinical medicine to public health. And I came to the University at Albany School of Public Health to get my master's in public health. And I'm now pursuing my doctor of public health at UAlbany itself. And in early 2020, I started working at the Center for Health Workforce Studies, located at the School of Public Health at the University at Albany. And within the center, I focus on oral health. So I work at the Oral Health Workforce Research Center, which incidentally is the only federally funded oral health workforce research center in the country. And our goal is to research oral health workforce and assist in the future workforce planning.
Wonderful. So this isn't a topic that we have a lot on the podcast. So certainly interested in hearing more about the oral health issues that's facing the workforce today. Your Kevin MD article is titled Revolutionizing Oral Health Care, the Affordable Solution That's Breaking Barriers and Boosting Health Equity. So tell me, how did your article come together?
So when it comes to access to care, we know that health insurance does not mean access.
Mm-hmm.
It's an important step, but it is not the only step. So put it another way, and I want to emphasize this, health insurance or dental insurance does not mean patients have access to care. But let's start there. In the US, there are over 75 million Americans with no dental insurance. Now, this is in spite of decades and decades of research, which has shown us that oral health is an integral part of overall health. And in the US, there are about 331 million people, and 75 million of them have no dental insurance. Let that number sink in, 75 million. And even if they did, 70 million Americans live in dental health professional shortage areas. These are essentially provided deserts where you will either not have or have limited access to an oral health provider. And the Oral Health Workforce Research Center, we have researched the dental therapy model before, and I really wanted to share some of our findings as well as the research from the broader scholarship about how effective dental therapists have been in advancing health equity.
So before we get into that, you did say that oral health is integral to overall health. Give us some individual examples. So I think that, intuitively, obviously, that makes a lot of sense. But give us some specific examples that can really illustrate that point.
Oral health has been linked to poor heart disease, to diabetes, pregnancy complications, pneumonia, and so much more. In the US, we often forget that the mouth is actually a part of the body, the way insurance and providers are organized. But it is absolutely an essential part of our body, which which we need to pay attention to.
And you mentioned these dental health worker deserts. What are some of the reasons that precipitates that?
Well, so something that we know is that the dentistry's workforce is predominantly white and affluent, and health equity has been a significant issue in this population. So there are communities where either oral health providers simply don't go and practice because of it could be related to reimbursement issues, related to the infrastructure. There is quite a few reasons. Yeah.
So, in terms of next steps, in terms of what some possible solutions are, what are some options that we have facing this issue?
So one thing is, even though I said dental insurance does not mean access, one thing I mean, it has to be addressed from several different directions. The
Yeah.
first of which is making sure people have access to care. Now, we know that Medicaid dental benefits don't exist for everyone in all the states, and on occasion, whenever states are strapped for cash, oftentimes Medicaid dental benefits are the first to go. So it's essential to make sure that people have the insurance. And we also need to make sure that a lot of the people, they go and they receive their services from the safety net, from federally qualified health centers, which have been pushed to the limit during the pandemic. They are understaffed, they are underfunded.
Hmm.
So we need to make sure that FQHCs and other safety net organizations are also supported in the work that they do. And then there's also things like addressing burnout and resilience in the oral health workforce. Again, something that's been there for ages, but it really came to the forefront during the pandemic, which is in fact one of the reasons I think it's a priority area for the US Surgeon General to make sure the workforce is protected from burnout and stress.
So we hear about burnout and stress certainly within the medical profession, but go more into the dental profession specifically in terms of how that's decimating the workforce.
So interestingly, the Oral Health Workforce Research Center, we did a project just last year where we did a number of key informant qualitative interviews. The report is actually available on our website. We really wanted to talk to oral health providers. We talked to dental directors, FQHC directors to learn about their experiences. And one of the things we've noticed is that a lot of people, especially during the early parts of the pandemic, a lot of the workforce or the oral health workforce, they left. I mean, that was a very early on in the pandemic. There were a few percentage points of the entire dental hygiene workforce which left. And that is causing so much problem across the board because when the workforce leaves, there's longer delays, and then which means that you might have to wait for months. And in some cases, we've heard of instances where patients have to wait for over a year to get an
Mm.
appointment. And when they come back, a problem which could have been addressed fairly easily now over a year has progressed to something far more serious. So what could have been a fairly simple restorative procedure now is a very complex procedure. So which keeps adding to the workload of the workforce.
So, as a solution, you mentioned dental therapists. Talk more about that.
So dental therapists have been around for a long time. The dental therapy model, it started in New Zealand over a century ago. And we at the Oral Health Workforce Research Center have been researching the dental therapy workforce for a while. And we have partnered with a number of really incredible organizations that have dental therapists on their team. And what we have found is that dental therapists have significantly improved the access to care, especially in vulnerable populations. Now, like I said earlier, the dentistry's workforce is predominantly white and affluent. And dental therapists, however, they represent the community that they serve. And they have had tremendous impact, especially in rural communities like in Alaska, on on improving access to tens of thousands of people. And the dental therapy model has, in the US, started in the early 2000s in Alaska, but it has since expanded to over a dozen states now.
So contrast what dental therapists can and can't do in relation to dentists, and what's their scope of practice in comparison to dentists.
So when it comes to oral health providers like dental assistants, dental hygienists, dental therapists, and dentists, the scope of practice is different. And definitely there are some procedures which dental therapists can perform, similar to dental hygienists. But again, the scope of practice of dental therapists is a little narrower than the entire scope allowed by dentists.
And can they practice independently, or do they have to practice under the purview of a dentist?
So the authorization requirements vary across the states. That particular question, I would have to pull up our very own infograph to find the answers to that. But often they work under the purview of a dentist.
And in terms of the training model, how many years does it take to become a dental therapist?
The training model varies depending on the state, but it could be anywhere between 3 to several more years.
So tell us your ideal world. If you were in charge of oral health public care policy, what would you like the ideal world to be?
I would authorize dental therapists to practice in all states. Dental therapists come from the communities that they serve. They serve care to underserved and vulnerable populations where you might not find a dentist. So an ideal world is where dental therapists, similar to dentists and dental hygienists and dental assistants, can practice, be a part of the dental team in meeting the needs of the population. Now, interestingly, what research shows is that after a dental therapist was actually added to the team, it meant that patients reported to having shorter waiting times. It allowed patients to have more of their health needs met in a single visit. It gave the patients a sense of having a regular provider. These are all tremendously important, especially in some very rural and underserved areas.
And where are we now in terms of policy to implement your vision?
So the states have to enact the legislation to authorize dental therapists, and right now over a dozen states allow dental therapists to practice in those states. And this is keeping in mind that the dental therapy model itself began in the US in the early 2000s. So in less than 2 decades, we've had more than a dozen states which have authorized dental therapists to practice in their states, which I think is tremendous. So to enact that enact that wonderful vision, I'd say a lot of state coalitions and oral health providers in the states that they practice, they have to come together and recognize the tremendous potential that dental therapists can have. And that requires collaborations, partnerships, more research, and giving this workforce model an opportunity to really matter and provide services to the populations that are very much in need of them.
So, talk about some of the obstacles that prevent this from being implemented. Are you encountering any pushback from any groups to this dental therapy model?
That's a that's an interesting question. So when the model was first introduced in the early 2000s, there was quite a bit of there was a fair bit of resistance from organized dentistry. And but what we have found is, and research supports this, what we have found is that after dentists have actually had an opportunity to have a dental therapist on their team and see what they're capable of doing. And when a dental therapist comes and joins a team, they end up the dentists end up doing fewer basic preventive and restorative services, which actually allow dentists to take on more complex roles and work to the full potential of their scope. So that pushback has somewhat, so that initial resistance has somewhat lessened. So, which I think is a wonderful thing for the progression and expansion of this model.
In a typical dental practice, what do you
Mhm.
envision the role of the dental therapist?
A dental therapist would take on basic preventive and restorative services. They will see the patients and they will collaborate with dental hygienists and dentists. They are essentially a, a tremendous part of the dental team. And some of the research that I mentioned earlier is regarding an organization that actually works with dental therapists. And what they found was that even when a dental therapist joins their team, that they're very welcomed by the other provider models within the dental team, which I think is fantastic.
Now, when you say restorative services, can you do procedures?
Yes. Yep. They can do procedures.
All right. We're talking to Theekshana Fernando. He's a research scientist. His Kevin MD article is titled Revolutionizing Oral Health Care, the Affordable Solution That's Breaking Barriers and Boosting Health Equity. A final question. Tell us some of your take home messages that you want to leave with the Kevin MD audience.
Well, the complexity of the healthcare system in the US and the complexity of the oral healthcare system in the US means that it's very unlikely for there to be one single grand solution that's going to solve all the problems. But that being said, here are dental therapists which have proven to be effective at increasing access to vulnerable and priority populations. The take-home message that I would have to your audience is to think about how they can integrate processes and protocols to truly offer integrated healthcare and to use their positions of power and privilege to identify, advocate, research health workforce models such as dental therapists who are proving to be so very instrumental in offering services to priority populations that actually need those services.
Well, thank you so much for sharing your time and insight. Thanks for coming on the show.
Thank you so much for the opportunity, Kevin.